I've joined the organization within the last 2 years. One of the things that motivated me to come here was that there is this distributed medical education program here, and what I see as a really excellent emerging partnership between our universities, the health system, and the opportunities to grow that.
How long has the pain been going on?
I guess about 2 weeks.
In a region like Island Health, a student would have very much a one-to-one relationship with a key preceptor or a group of preceptors. They have the opportunity to actually be looking after patients in the hospital. They may be involved in procedures or other interventions, and they might have the added benefit of following their preceptor into their community practice and seeing patients either in consultation or in an ambulatory care center. Their experience goes beyond the hospital. It goes into other community settings where they're working with other practitioners, nurse practitioners, our public health staff, maybe working in Aboriginal communities. It's a broad and a very from the kind of ground up experience for medical students working in a community like those on the island. Anybody that I speak to and on the island who have been part of this, it's amazing how they appreciate the very broad impacts that this partnership has had. It's very much contributed to a different culture in our organization, and they see what it's like to be in an environment with people who are learning and thinking and asking questions, and that actually, it rubs off on everybody. So the education model grows beyond just the learners. It has an impact on our teams and ultimately on the quality of the care that they're delivering for our patients. The medical training programs that we've been able to develop in partnership with UVic and UBC have created a very strong foundation for other education programs and other learners. Now that we've kind of gained some proficiency with our medical education programs, we're starting to see that ripple out into other health professions and other disciplines. As an organization like ours learns how to be a partner in this, we can easily extend that to other disciplines and other models. So I think that's been extremely positive for our organization. When students have an opportunity to experience what it's like to practice in a community, in a regional setting, they're much more likely to choose that stream. If they haven't had the opportunity to experience that, and they've done all of their training in a tertiary center or in an urban center, they just don't know what they don't know. And so I think it's a value for students because many students want to understand this or want to explore it, and there's certainly a benefit to us and to our communities, because in creating those educational opportunities, we believe that we're also creating future relationships with physicians and other health professionals who will want to come back to those communities and could see themselves living in those communities and raising families or doing whatever they want to do.